Joining us now via telephone, public health expert Betsy McCaughey. Betsy, in 2000, we declared that measles had been eliminated.
Well, that's right. But you only heard half the story from Dr. Fauci. It is true that children who are vaccinated don't get measles. But sadly, our federal government is not taking any responsibility at all for preventing people who are carrying measles from entering the country. In fact, I landed at JFK Airport last night, and going through customs, there was a big sign telling travelers, here are the symptoms of measles. If you have these symptoms, see a doctor. That's the wrong sign. The sign should say, if your family has not been vaccinated against measles, see a customs and immigration official.
And, well, you're just talking about legal immigration.
Well, that's right.
And you take a look at the last year, the influx of juveniles from Central America. Obviously, we have problems. So there are a couple of reasons at work. Let's go back to the numbers and just show what the increase has been. The average number of cases of measles in the United States between 2001 and 2013 was only 88. The number of cases last year, 644. So, Betsy, you're telling us part of it is an anti-vaccine movement, but the other part is illegal immigration.
It's immigration of all sorts. Let me give you some specifics. There were some outbreaks in Ohio and Pennsylvania when Amish missionaries went to the Philippines, were exposed to measles there and brought it back. But also there was an outbreak in California when travelers from the Philippines, where measles is still prevalent, brought it back. Then there was an outbreak in Houston, Texas, when Mexican immigrants, I don't know their immigration status, had measles, and it was obviously imparted to residents of the Houston area. So travel, cross-border carriage of this disease is a big factor. We declared measles defeated in 2000 because the virus no longer presented a problem here, but now we're allowing it to be carried into the country, and that's wrong.
Betsy, let's go back to talk about how the movement, the anti-vaccine movement, took a hold in the suburbs of California. Do you think that this could possibly be attributed to a fear of autism?
Yes, well, we hear many parents, and of course, I'm a parent and a grandparent, so I understand when parents are worried about allowing their children to be injected with anything. We all put an emotional fence around our children. But unfortunately, in the case of measles, there is no evidence that this MMR vaccine is dangerous to children, but we know measles is really dangerous. 1 out of every 1,000 cases results in death. And even when it doesn't result in death, it can result in very serious illnesses, pneumonia, encephalitis. And so we want to make sure that children are vaccinated against measles. Just to give you an idea how risky this is, measles is almost 100% contagious. It's not like the flu virus where some people get it and some people don't. If you're exposed to measles and you haven't been vaccinated, it's a 98% chance that you're going to get it.
We've got a little more than 3 minutes remaining for the conversation, Betsy. In the situation in California, state officials claim that 5 people who contracted measles had been fully vaccinated. Mm-hmm. And you're a public policy expert, not a doctor, but any insight on how something like that could happen?
I don't have the specifics on that. Of course, in the world of science, things happen. And we see that sometimes vaccines are more effective than other times. But in general, the MMR vaccine is highly effective and highly safe. And so I think it's really important for parents to get their kids vaccinated. And I agree with you. There are pockets around the nation, some related to religion, the Orthodox Jewish community in some places, the Amish in other places. In some, like the San Diego area, it's just parents who have spent a lot of time on websites and educating themselves about vaccines, and I said I'm very sympathetic to their concerns about their children. But in this particular case, there doesn't seem to be any scientific evidence that the measles vaccine, MMR, mumps, measles, and rubella vaccine, is dangerous.
Betsy, short of making a policy mandating that all children get vaccinated, how do you think we can change the conversation to make
Well,
parents...
the first thing we have to do is be much more rigorous about who comes into the country.
Right.
You know, other countries erect barriers and say, if you want to come into our country, you must have the following shots. Well, the United States should be saying to parents all over the world, if you want to bring your children here to Disneyland, make sure that they have been adequately vaccinated for mumps, measles, and rubella, period.
Betsy, there's one other notion on the 5 who contracted it despite having been vaccinated. The other piece of data I don't have here is the age of those people. I've heard some talk that if you were vaccinated for measles in the early 60s, you may need a booster.
Well, that's possible. That's possible, and you should definitely ask your doctor about that because measles is a very dangerous disease. Of course, most of us assumed that we'd never be exposed to measles again unless we traveled to a place like the Philippines where it's still prevalent because it isn't in this country. But now the tables have turned.
Betsy, just quickly to update viewers out there, what are some of the symptoms that people should look out for when it comes to these?
Well, measles, it's pretty easy to see. It's a rash. It starts on your head and it moves down the trunk of your body. It's accompanied by a fever. So if there are signs of measles, you should definitely see a doctor. But unlike the sign in the airport, don't come to the United States unless your children have been vaccinated. And if you're traveling abroad with your children especially, be aware if there are countries where measles are still prevalent. Be very aware because it is very, very, very contagious.
Betsy McCaughey, we thank you for your time as you telephoned in from Connecticut today about what is transpiring with measles in terms of our immigration policy and the personal anti-vaccination policy, sadly, of some parents. We do appreciate it. There is plenty to talk about. When we come back, we'll get an update on the proceedings against the Boston bomber from lawyer Jeffrey Nathan. Also later this hour, meteorologist Joe Bastardi on the pending blizzard in the Northeast. Now, a Newsmax Now update.